Did you know that every 40 seconds, someone in the United States has a stroke? It's a startling statistic. But what's even more alarming is that many people miss the early warning signs. If I told you that cerebrovascular accident, CVA, also known as a stroke, is one of the leading causes of death, you might think you know what to look for. Slurred speech, facial drooping, weakness on one side. But what if I told you there are 7 unusual symptoms that could indicate you're having a stroke? Signs that most people overlook? Imagine this. You're going about your day when suddenly, something feels off. It's not the typical symptoms you've heard about, but deep down, you sense something is seriously wrong. What if that strange feeling was actually your body desperately trying to warn you of an impending stroke? In this eye-opening video, we're about to reveal 8 unusual and often overlooked signs of stroke that medical professionals don't talk about enough. These hidden symptoms could be the key to preventing a catastrophic brain event, but most people have no idea they exist. By the end of this video, you'll be armed with potentially life-saving knowledge that less than 40% of the population possesses. But first, we'll share a shocking statistic that will make you rethink everything you thought you knew about who's at risk for stroke. It's a number that's been quietly rising, and it might just hit closer to home than you ever imagined. Are you ready to uncover the truth and potentially save a life? Stay tuned, because what you're about to learn could be the difference between life and death. From 8 occurrences per 100,000 people in 2010 to 41.1 per 100,000 in 2007. 2021, stroke incidents have increased significantly. Moreover, strokes can affect individuals of any age, and it is a misconception that only older adults are at risk. According to 2014 CDC data, 38% of those hospitalized for strokes were younger than 65. Recognizing the warning signs and symptoms of a stroke is crucial, as prompt emergency care can be the difference between recovery and long-term disability. Awareness of symptoms is essential. For example, a survey found that while 93% of participants knew that sudden numbness on one side of the body could signal a stroke, only 38% were aware of all the major symptoms and the importance of calling 911 during a stroke. Are you familiar with the signs of a stroke? In point 8, you will be shocked by the scientific findings we describe. Stay with us to learn more. Brace yourself for a deep dive into the latest analyses and groundbreaking reports on stroke mortality across the globe. In the final installment of our video promises to reveal startling statistics and jaw-dropping insights into mortality rates, stay tuned, you won't want to miss this eye-opening discovery.
1. Vision loss. Sudden vision loss or experiencing double vision can be an early indicator of a stroke, similar to sudden weakness. Many people may not realize that losing sight in one or both eyes can serve as a warning sign. This vision impairment can occur abruptly and without any prior notice, signifying a medical emergency. It happens when the blood supply to the brain regions responsible for vision is disrupted or diminished, leading to a lack of oxygen and nutrients for the brain tissue. Besides complete or partial vision loss, some individuals might encounter double vision, known as diplopia, where they perceive 2 images of a single object. These visual symptoms might also be accompanied by other stroke indicators, such as weakness on one side of the body or difficulty in speaking. 2. Vertigo and loss of balance. Vertigo and a loss of balance or coordination are lesser-known indicators of a stroke that can appear suddenly. Vertigo, a type of dizziness where an individual feels as though their surroundings are spinning, can be particularly unsettling when there is no clear cause. A loss of balance or coordination may lead to stumbling, difficulty walking, or an inability to stand, potentially signaling a stroke that impacts the brain regions responsible for movement and spatial awareness. These symptoms might be mistaken for other medical issues like labyrinthitis, but when they occur alongside other stroke symptoms, they signify a medical emergency that demands immediate attention. 3. Sudden confusion. Sudden confusion, marked by an unexpected struggle to comprehend your surroundings or articulate your thoughts clearly, is a crucial indicator of a potential stroke. This symptom may present as disorientation, trouble following conversations, or difficulty in forming words and understanding others' speech. A stroke impacts the brain in ways that can temporarily or permanently impair cognitive functions and communication, depending on which brain region is affected and the extent of the damage. When blood flow to the brain areas responsible for language and cognitive processing is interrupted, individuals may experience aphasia, a condition that hinders communication abilities. Aphasia can range from having trouble finding the right words to a complete inability to speak or understand spoken language. This stroke symptom is particularly concerning because it can emerge suddenly and without warning, often without any pain or sensation that signals a serious issue. Fourth, headache with no identified. A sudden, intense headache with no apparent cause could signal a stroke, particularly a hemorrhagic stroke, where bleeding occurs in the brain. This headache is often described as the most severe the person has ever experienced and may be accompanied by symptoms like nausea, vomiting, light sensitivity, or changes in consciousness. Unlike typical headaches such as migraines or tension headaches, a stroke-related headache appears abruptly and can quickly worsen. The severe pain associated with a hemorrhagic stroke is due to increased pressure inside the skull from bleeding, which can irritate the brain's protective membranes or other brain tissues. This pressure can cause intense pain and, in some cases, lead to unconsciousness. Recognizing that a sudden and extremely severe headache requires immediate medical attention is crucial, as early stroke treatment can significantly impact the patient's long-term recovery. 5. Sudden nausea or vomiting. If you suddenly feel nauseous or vomit, it might be a sign of a stroke, especially if there is no obvious reason for it, such as a viral illness or food poisoning. This symptom is often seen in hemorrhagic strokes, which occur when bleeding in the brain increases pressure within the skull, resulting in pain and vomiting. The direct effect of pressure or injury on the areas of the brain that are responsible for nausea and vomiting is the underlying cause of this symptom. 6. Photophobia, or increased sensitivity to light, is not often associated with strokes, although it may occur in certain situations. This disorder may occur as a result of increased pressure in the brain or hemorrhage close to the nerves that are involved for visual processing. Photophobia may be so severe that even typical or sunshine might seem excessively bright, resulting in significant pain or the need to stay away from places that are well lit. Photophobia may be caused by a number of different things, but when it occurs with other symptoms of a stroke, it is a clear indication that you need to get medical help right away. 7. Some of the most common signs of a stroke are changes in speech patterns, such as slurred speech, trouble finding words, and incomprehensible speech. On the other hand, these symptoms might present themselves in a number of different ways. These changes might be indicative of a stroke that is affecting the areas of the brain that are important for language and communication. These changes in speech may be moderate or severe, and they may be one of the first indicators of a stroke, especially if other reasons, such as alcoholism or low blood sugar, have been checked out. Recognizing these signs quickly and getting medical help right away will improve the chances of recovering speech and language skills in the long run. It is important to understand the risk factors, which include high blood pressure, diabetes, smoking, obesity, family history, and a lack of physical exercise. 8. Sudden fatigue or weakness. Stroke, a medical emergency caused by a disruption in blood flow to the brain, is widely recognized by common symptoms like facial drooping and limb weakness. However, sudden and unexplained fatigue or weakness is an underreported but critical warning sign of a stroke. During a stroke, brain damage disrupts energy regulation and muscle function, potentially leading to an overwhelming sense of fatigue. This symptom may present alone or alongside other stroke indicators, such as unilateral muscle weakness. Fatigue can also result from reduced oxygen delivery to critical brain areas, impairing their ability to function properly. Post-stroke fatigue, PSF, is a common symptom experienced by many stroke survivors. It can significantly impact cognitive functions such as memory, emotional regulation, and overall energy levels. Individuals often report feeling exhausted even after adequate rest. Studies indicate that the prevalence of post-stroke fatigue ranges between 23% and 85%, with symptoms often persisting long after the initial stroke event. PSF is defined by rapid exhaustion during mental or physical activity and is not alleviated by rest, posing challenges to recovery and quality of life. Longitudinal studies reveal that 37% of stroke survivors experience fatigue up to 6 years post-stroke. This fatigue is often associated with higher levels of anxiety, depression, and difficulties in daily activities. Sudden and unexplained fatigue or weakness should not be ignored, especially when accompanied by other stroke symptoms. Prompt recognition and medical intervention can significantly improve outcomes and reduce the risk of long-term complications. By recognizing and controlling these variables, the likelihood of having a stroke may be greatly reduced. Making changes to your lifestyle is the first step to prevention. This includes things like eating a balanced diet, exercising regularly, keeping your blood pressure and cholesterol levels in check, and not smoking. Because smoking is associated with a number of health problems, it is essential to avoid cigarettes. It is also important to keep a healthy weight and to keep an eye on any health problems that you may have. It is essential to respond quickly in the case of a stroke. Depending on the kind of stroke, treatment may include drugs to dissolve blood clots or surgery to restore blood arteries that have been damaged. Rehabilitation is essential for assisting patients in recovering their abilities and avoiding future strokes. Being able to identify these uncommon stroke symptoms may be the difference between recovering and suffering serious repercussions. If you or someone you know has any of these symptoms, get medical help right once. A prompt answer from you might save someone's life. A global health crisis with widening disparities. Stroke remains a formidable health challenge, holding its place as the second leading cause of death globally. Despite strides in medical advancements, the global burden of stroke continues to paint a stark picture of disparity and vulnerability, particularly in low- and middle-income countries, LMICs. A closer examination of recent studies reveals intriguing trends and critical insights into the shifting landscape of stroke mortality and risk factors. From 1990 to 2021, stroke incidence and mortality exhibited contrasting patterns across the socioeconomic spectrum. High-income nations saw significant declines in age-standardized stroke mortality rates, attributed to improved healthcare systems and preventive measures. Conversely, LMICs, which shoulder a staggering 87.2% of stroke-related deaths, faced persistent or worsening trends. In 2021 alone, there were approximately 12 million new stroke cases, and praritone 7.3 million deaths, marking a 70% increase in incidence, and a 43% rise in deaths since 1990. This escalating burden underscores the widening health inequities between regions. Ischemic strokes, the predominant subtype, accounted for 65.3% of all strokes. In 2021, while hemorrhagic strokes posed a greater threat in Asia and LMICs, where limited access to healthcare exacerbates mortality. Notably, regions like Central Asia, East Asia, and Sub-Saharan Africa report the highest stroke burdens, highlighting the interplay of socioeconomic and environmental factors. Demographic data reveals that 60% of strokes occur in individuals under 70. signaling an alarming rise in early-onset cases, with a lifetime stroke risk now nearing 1 in 4. Lifestyle changes, urbanization, and environmental stressors emerge as potent contributors. Gender differences further complicate the picture. While men exhibit higher age-standardized mortality rates, women often suffer worse post-stroke outcomes, with predictions of a steep rise in ischemic stroke incidence among women by 2030. Regional disparities remain stark. Oceania leads in hemorrhagic stroke mortality, whereas ischemic stroke deaths are most prevalent in Central Asia and Eastern Europe. High-income countries benefit from advanced treatment protocols, yet even they faced setbacks during the COVID-19 pandemic, which disrupted stroke care and delayed hospitalizations globally. Hypertension, obesity, smoking, and poor dietary habits dominate the list of modifiable risk factors. Emerging research adds sugar-sweetened beverages, air pollution, and even climate change to this web of causation. A study on the influence of smoking in China, for instance, linked it directly to elevated stroke mortality. Meanwhile, dietary patterns, as highlighted in global studies, disproportionately affect low- and middle-income countries, where public health interventions are scarce. Interestingly, the pandemic has also left a lasting imprint on stroke mortality. Delayed care and healthcare disruptions not only exacerbated outcomes, but also underscored the fragility of healthcare infrastructures worldwide. Addressing the global stroke crisis demands multi-pronged strategies tailored to regional needs. Public health campaigns that tackle hypertension, promote balanced diets, and reduce smoking rates could alleviate a significant portion of the stroke burden. Equally crucial is enhancing healthcare access in underserved areas, particularly for low- and middle-income countries grappling with resource constraints. The grim reality is that the disparities in stroke outcomes are not merely medical challenges, but reflections of deeper socioeconomic inequalities. As the global population continues to age, proactive measures and equity-focused interventions will be indispensable in mitigating the devastating toll of stroke. Only through collective action can we transform this pressing challenge into an opportunity for progress and healthier lives worldwide.